everyone. Thank you for joining. My name is Kaylee Fontana. I'm the Marketing Campaign Manager here at TeleTracking, and I will be the moderator today for our session on introducing the mobile apps for our capacity management suite. We have a very large group joining us today, so I just want to make sure that I cover a few housekeeping items so everybody is in the loop on what the next steps are as far as follow-up. And obviously the biggest question we get is, will the webinar recording and slide deck be available for everybody who attends? And that is absolutely yes. So you will be receiving an email from myself. Again, my name is Kaylee Fontana, probably at the end of today or tomorrow, depending on how long the webinar takes to process here on our end. But I'll be sending that through email. And we also want to make sure that this is an interactive session. We have about 20 minutes at the end of this meeting for you to ask questions. So if you would like to enter those into the question and answer pane in the WebEx console at any time throughout the session, we will hold the questions till the end of the presentation and go through as many as we possibly can. Also, we're trying something new this year. We're going to have a little pop-up survey. It's only 5 questions at the very conclusion of the webinar, so please make sure to take that survey. It's just going to allow us to utilize that feedback for future offerings of this session and other teletracking webinars. So if you have questions between now and when my email comes out, please feel free to send an email to marketing@teletracking.com. I'll try to respond back to you as soon as possible. So if there's a question that did not get asked or answered, I can filter that to our 2 presenters and hopefully get that question for you within the next 24 hours. So I'm not going to take too much more of your time up, but I'd like to introduce the 2 presenters. Today, Reagan Morrow, the Solution Line Lead for our TeleTracking mobile application, is here to talk to us today. She has been with TeleTracking for over 3 years, working within varying product lines. Prior to TeleTracking, Reagan worked as a biomedical engineer for a division of the FCC. In that role, she provided SAR engineering support to the world's largest wireless electronic provider. We also have Jamie Slater here. He's the user experience designer for the mobile applications, and as part of the mobile team, Jamie conducts user research, designs the user interface and the user experience of the applications, and collaborates with the engineering team to bring mobile solutions to life. He has been with TeleTracking for almost 2 years. Prior to TeleTracking, Jamie consulted as a design strategist for companies within healthcare, manufacturing, insurance, and banking industries. So you have 2 very qualified and very smart individuals leading this session today. So quickly, I'd like to cover the objectives. Number 1, we're going to review the mobile apps portfolio for Capacity Management Suite. We are also going to articulate the features, design, and benefits of mobile, and then we will do an in-depth demonstration of TeleTracking's newest workflow-driven apps, EVS and Transport. Very, very excited to have Reagan and Jamie here, so without further ado, I'm going to pass it on to Reagan.
Thanks, Haley. Hi everyone. I hope everyone's doing well this afternoon. I'd like to start here with really walking us through some of the benefits for why mobile is important, and more important, specifically in healthcare. There's a lot of information on this slide, but some of the key points I really want to hit on is now that we do have a platform that offers 6 different role-based offerings, which we will get to in some of the further slides. And we'll be doing an in-depth demo of our 2 newest applications that we've added to this portfolio. But the values that we've really been trying to hit on when offering this new platform in the last few years is the availability of real-time data, the ability for our clients to be able to effectively communicate about that data, also the ability for them to spend less time behind a desktop and more time with their patients or completing operational tasks. With that in the past, that might not have been something that was as streamlined or as easy, but given our goal, which is to not allow for any patient to wait for the care that they need, with this portfolio and these 6 applications, we really are trying to drive and increase operational efficiency across the board. That brings us into our next slide here. This is a specific case study that was conducted a few years back with one of our current clients, Fry Regional Medical Center. What this is showing you here is that at the point of adoption of our previous application, which Mobile XT, you can see that there is significant improvements in their transport team's operational efficiency. So what this is showing you here is that before adopting Mobile XT, Toronto Medical Center was using a pager and/or IVR solution for transport. Since then, adopting our Mobile XT application, you can see that their average transport time went down by 26%. Response times for transport on average went down to 33%. Pending dispatch went down to 36%. So just overall, just showing that these capabilities, not only for transport, but across the other roles that I'll present to you in a minute, helps to drive that operational efficiency. Here we'll show you the full mobile portfolio. As you'll see here, for those of you who are current Mobile XT clients, you do not see Mobile XT in this portfolio. That is because it is not a part of this portfolio, and Jamie will be going through some of that in a couple minutes and explaining to you what I mean by this portfolio. Specifically, as a part of this new mobile platform, what we have are 6 role-based apps that are data and workflow driven. We are going to be specifically diving into an EVS and transport demo, but I'd like to go through each of these at a very high level, just to give you an understanding of the capabilities that are a part of each of these 6 apps. Let's start with our executive app, and we'll work our way down to environmental services. So our executive app is geared towards your upper level management. So your CNOs, CTOs, whoever it be in your health system, really giving them an understanding and a quick real-time glance on the health of the health system. So census information, it breaks that census information down by service line as well, really giving them an understanding of what's currently going on in their organization. Our patient flow app, or patient flow manager app, is really geared towards your health supervisors or your patient flow managers. There's lots of different names for this role. This role is typically quite cross-functional. They, help with some of the clinical stuff and also are for driving operational efficiency. There's a lot of data and goodness that's in this app. A lot of data around, census and clinical information, patients who are coming and going from the campus or campuses that they are supporting. Also marry in our EVS and transport metrics as well. Understanding that both operational and clinical data and both need to be efficient in order to drive our workflow within our organization. Our nurse app, I like to think of this as like our air traffic control app, giving your charge nurses an understanding of who is coming and going from their unit and who is currently on their unit at this point in time. So it's really an operational app, really showing the availability of those beds, the status of them, and then the patients who are coming and going in those beds. Our bedside nurse app is really geared towards your front end bedside nurses or staff nurses who are out on the floor, have patients assigned to them. I like to think of this as a skimmed down or lesser view of your patient tracking portal screens. For those of you who are current capacity management suite customers using our patient tracking portal, you know that portal has a unit view, so patients for the whole unit. This app would show your nurses a view of patient information specifically for those patients who are assigned to them. Now into our transport and EVS app. I'm going to be pretty high level on these because I want to talk about these more during the demo posted on this slide. But again, these are replacement for our Mobile XT application, which is being used out in the field currently. Our transporter app is really geared for your front-end transporters, allowing them to receive jobs, take jobs in progress, put them in delay, suspend. Again, we'll go through those things, but essentially put them through that process and allow them to do that work throughout the organization. Environmental services is quite similar. It's for your front-end environmental services staff, allowing them to, again, receive those jobs, those dirty bed jobs, allowing them to put that in progress, complete that job, and get that bed turned over for the next patient to be able to then be placed in that bed. I'm going to pass it off to Jamie. He's going to go into a little bit more detail on the platform design, and then a little more detail around the changes that we made specifically for the EVS and transport.
Thank you, Reagan. So let's talk a little bit about the design. So essentially, for our first bullet point here, design system for consistency. If you have seen all 6 of these applications, you'll notice that they have a very similar look and feel, and they're all built on the same platform. So basically one source of truth for all 6 applications. So there's not going to be a lot of differences between them, very similar look and feel and very similar interactivity. They all 6 of them have the navigation and kind of header and everything in the same places. I have a cross-platform framework for flexibility, and what that really allows us to do is, if those are using MobileX today, you know that it's iOS only. For all 6 of these new applications, we're compatible with iOS and Android devices. All 6 of these are also tailored to specific roles within the hospital for a simpler and more relevant user experience. So the idea here is that if you do, as Reagan said, use our kind of portal today, our patient tracking portal, you know that it is really geared towards serving the needs of many different users and many different roles throughout the hospital. So these are really tailored to specifically to those specific roles that we're designing for. So it can be a lot more kind of, nitty and a lot more kind of tailored to exactly what they want to see and where they want to see it and how they can complete those tasks. The last one here, mobile apps meet mobile accessibility guidelines. I don't know if anyone's heard of the WCAG, but essentially these are web accessibility guidelines for those with visual disabilities. And basically what this is saying is that we meet color contrast requirements, type size requirements, interactivity like touch target size, and all of those things are built in a way that should be much more usable than any applications that you've used from us in the past. When we talk specifically about the new EVS and Transporter app, this is the next generation of MobileXT. So MobileXT was a combined app for EVS and transport teams in the past and is now going to be 2 applications, one application for each of those roles. Some specific things that we've improved as part of this upgrade is that they're more cost-effective and compatible with iOS and Android devices. We have a dark theme, which I can show off in the demo. Get close to that. We have a simplified user experience. So those who are using the applications today, you know that you have to take like 3 clicks to kind of take a job in progress. It's now going to be 2 clicks. So a lot of little things like that hopefully will add to less clicks and a better user experience. The ability to customize and change notification sounds and volume. So this will be a feature that's available for Android devices and potentially iOS and devices in the future, but we'll have to see. We have improved battery performance, and this is really around the idea that it's a native application instead of a web wrapper application. So we have a lot better improved battery performance, as well as pull to refresh instead of auto refresh improves the battery performance. The ability to scale, so we can easily deploy and manage multiple devices. So we're now compatible with mobile device management systems. So you can use those to deploy to many devices at once instead of having to manually configure devices one at a time. We have increased security, so all of our apps now use username and password instead of IVR IDs to log in.
Yep, thank you. Now we are going to move to the demo, so just give us 1 second to get it set up here because we are going to be actually doing a live demo for you guys.
And just a reminder, too, we have a couple questions coming in, but make sure that you're entering them onto the WebEx QA panel. So just keep them coming and get to those at the end of the webinar.
Now switch what I'm showing to. So you have to pull down and find that. Server. Can we ask them if they can see the application, the mobile app? Sorry.
So we're seeing the mobile screen on the webinar pane, so it's coming up for me, so it looks okay.
Cool. I don't want this. Okay, cool. Just give me one sec. Cool. Sorry. Try.
There we go.
Perfect.
Yep, should
great.
be good. I'm going to kind of give a high-level overview. Now, what we're looking at now is the EVS application. This is for your housekeeping or environmental services teams. After sign-in, you come kind of directly to, if you don't have variable users, you come directly to the My Jobs page. If you do use Mobile XT today, this is a little bit different than what you're used to seeing. Basically, before you came to a home page, you can complete some of these tasks. Now you come to a jobs page where you can go on break. You can change your bed size if it's a configurable option that you can allow or not allow your EVS teams to complete. You can do a new job, which would be a found dirty bed or a found spill job. You can check and on the bottom navigation, you can check your messages. We're currently on the jobs tab, or you can go to settings, and I'll show off each of those. So let's just kind of go in order here. So to take a break, simply press the break button. We can kind of select our longer scheduled break from here and say start break. That can take us directly to the return to work screen. So now I can stay on this screen for the duration of my break. It's telling me that I'm currently on break, and all I need to do when I'm ready to come back and become an active and available member again is to return to work. So you can see on CMS on the left side of the screen, that's actually noting my user is currently on lunch. You can kind of keep track of that as a EV manager. So to return to work, I just need to approve this action, and you'll see on CMS that it will, it'll say you have returned from break successfully, and you'll see on the CMS side here in a second that I'm now available again. When I'm trying to change a bed size, I can do that very quickly. This first bed here, bed 706. So all you need to do is enter the ID of that to the system. It'll give you a pop-up here, essentially allowing you to change the bed size, and I can change it from a peds bed to an adult bed, for example, and submit that.
Let me refresh this. So right now,
I see in CMS on the left side that bed 706 is a pediatric bed, and as soon as she refreshes the page, it'll be an adult bed. I see that I received a push notification for that bed size change in the mobile device. So I can do a new job, and we can do a found dirty bed or a found spill job. So let's say I'm walking around the unit and I notice that there's a dirty bed and I'm not sure if it's in the system. I want to make sure that that bed gets cleaned. So I can enter any bed into the system here, and it will pop up and show me that information of that bed if there is a bed currently, a clean request current in the system or not. Let's go, for example, if I look on CMS bed 106, I can type that in. That is an occupied bed, and it's giving me a warning message to please confirm that the bed is no longer occupied before I proceed. We certainly wouldn't want to discharge that patient by marking the cleaning request. Cancel that. We can do a found spill. Let's kind of go directly on, let's try, which one?
120.
120? And see that there is a spill request here, and I can kind of take that directly in progress here, and it notes the spill type on the bottom of that card interface. So that's the basic functionality of those top menu items that you used to be able to complete on the Home tab of Mobile XT. If we scroll down here, I can kind of show off kind of the new process for taking beds in progress and delaying jobs. You can see the new bed card. This is a stat clean job. That gives you the name of that bed, any isolation status associated with that bed, NVR ID, as well as the size of that bed, and I can delay or take that bed in progress. So I'll kind of take that bed in progress real quick. So to take a bed in progress, it's a simple two-press action. You press the go in progress, and then you press yes. Now we'll move to the current job page, where we can see that this bed is now in progress. And one thing you might notice is that all the colors of the top bars of these cards now match what you see in CMS, which is something we didn't have before. So now there's just a nice kind of consistency between those two applications. You can click more options, and this is where I get the option to suspend a bed. So I'm just going to kind of take that action real quick. So brought to the suspend job page, where we select a suspension. Anything on this list would actually be a dictionary item that you could change within CMS. Was relevant for your health system. I'll say that I have a stat clean ready for me, and I can't complete this one right now, so I'll suspend the job. It'll pop up on my Jobs page as a suspended job, all my other jobs listed below it. To take that bed back in progress and simply open it up, you can see the reason it was delayed within the card interface now, and I can simply take that bed back in progress, and now I can complete the job whenever I'm ready to complete it. And once it's complete, you'll get a success message in the bottom pretty much after every action, kind of confirming that you've completed it.
It's changed now too.
And on CMS, you can see that the bed 706 has gone from a stat clean to a clean bed in the system. What I'd like to kind of test next, I'll have Reagan actually send me an instant notification, and we can test out the messages page. So while she's completing that, I'll actually show off the settings page. So you can see that it'll list my username at the top, right now, Patrick Bed Tracking. On the About page, we can see that there's just some simple legal information. This is just basic text related to the user agreement. Security, just kind of really high-level information about our security standards. I can add it if you would like. And you can also see the app version here, which is just the App Store version that you get within the App Store. So there you can see I received the push notification from Reagan on the Instant Notify that asked me if I did take my lunch. So while I'm in the settings page, before I check out messages, I'm just going to actually switch to the dark theme. This is just a user preference that you can select at any time. Let's say you're working the night shift and decide that you don't want to walk around with a bright phone just kind of around and you just want to change to dark theme, or you just happen to prefer the dark interface over the light one. You can change it at any time for any reason. So let's go to the messages page. We can check out those messages that I received from Reagan, as well as that bedside change notification that we acted earlier. So we can see here Reagan is asking me if I can take lunch. I can dismiss that message really quickly. And this message, any message that's over 2 lines long, that Ray kind of input there, she's kind of put a bunch of hyphens, but we can note that you could have any length of message. All you have to do is expand or contract that card to see the rest of the message. And if I want to dismiss all the messages at once, all I have to do is press that dismiss all messages. It'll bring a pop-up asking me, make sure that I want to do this. Press yes, and I'll kind of go back to I currently have no messages. That is the basic functionality, kind of from top to bottom, A to Z. The EVS application is fairly simple, but as you can see, very easily, kind of on the go, an EVS kind of employee can kind of go around and complete their work on the go.
I'll switch to transport tracking.
So just 1 second while we switch to transport tracking. I'll actually walk through the sign-in process, the new sign-in process for these applications. As you can see, there's a username and password field here instead of an IVR entry field. Once I enter my name and password, I can press sign in and kind of take me through the sign-in process. So this came directly to the My Job page. Just want a small note, if you are a variable user, which is essentially a user who needs to work in different areas of the hospital at different times, you would first be brought to a selection of an assignment page where you would select your section or zone in the hospital that you're working in today. We set up for this for simplicity, we set them up as a fixed user just so we could kind of go through them faster, but there would be an additional step for those who are variable users. So you can see very similar interface, very similar experience for the transport team as we had for EVS. We have our break, our mini task, which is another configurable item for your transporters where they can complete small tasks, things like fold linen or change light bulbs when they don't currently have transport jobs to complete. Job list, this would be for very select users, basically supervisors, who wanted to see all the pending jobs that are currently in the system on their mobile device. So you would likely, for most of your transporters, you would basically disable that feature. You would only see break and mini task in the top bar. Again, you have your messages and settings page on the bottom. So let's just kind of quickly walk through. As soon as I logged in, the system went and found the best job for me using the dispatch engine. Based on location or based on availability, based on priority, it sent me this job. So we have Ada Morrow here is our transport patient from ED's bed 17 to the RMC cath lab. We get a little bit of basically demographics information about this patient, their birth date and gender. These are things that are a little bit configurable in the system. You can change that to medical record number or visit number instead of transport patient if you don't want the actual transport patient name to be on the screen. So there's a little bit of configuration available how you display patient demographics information. We also show the isolation status of that patient, the mode of transport, which in this case is a bariatric stretcher. Mode of transport is another one of those dictionary items that you can configure and set according to your health system. And transport requirements. As you can see on the CMS screen on the left, this is the transport request form where you can enter all these things. So you can see mode of travel, the isolation step, isolation type, and those travel requirements on the bottom right where you can enter, those are also dictionary items where you can enter any number of those that you want to into the system. Notify that transporter of any of those things like fall risk, the fact that you know that they're going to need 2 transporters to request assist, that the person, wants to bring their belongings with them. So a lot of little things that you can add to help that transport go smoothly.
I'll create this for you so you get it to come across.
So the next section, I'm simply going to kind of go through the process of completing a transport job. So we accept job. This is going to be very similar. All I have to do is press to accept that job. It's going to need to, and one thing to note, I received an error message there because I sat on the screen for quite a long time, and there's actually a hold timer associated with transport jobs. So if you wait, and that's configurable actually, so if you wait the configured amount of time for a transport job, essentially that transport job will go being held to me, being sent to an additional user, because we want to make sure these transport jobs are done as quickly as possible. There's no other transporter in the system right now, so I can simply accept that job, and it'll take me to dispatched. So that's going, so the transport workflow is the same as it was before. It's simply in a state of pending, so that was what we first saw. We can go into then dispatched, then in progress, and then we can complete the job. So that process. So this is asking me, the main action next is to go in progress, or I can take a look at more options. You can see delay job and request assistance, and there may be even, I think, a few additional options here can be configured, but we can show delay job or request assistance here. Request assistance says, I want an additional transporter to help me off this job, and as soon as I request assistance, that'll be sent to multiple users, depending on how many I'm asking assistance for, and they can join my job and help me out. I can go to the delayed job screen just for a second here to kind of show that off. Very simple. You can select your reason for delay. Maybe the patient is currently eating, so we need to kind of wait till they're finished. We can delay the job, and that'll take me back to the job screen with a status of delayed, so I can see that job's delayed, and I can go back in progress whenever I need to. So that is there. There we go. So now we're in progress job. The same details here. I talked so much, I'll talk about this now actually. That top, the bar that's at the top is basically on the left, you're going to see the status of the job. In the middle is actually the job ID number. And on the far right is the priority of that job. And priority is based on a number of different factors that you can configure. What type of job it is, how long it's been waiting in the system, it's going to select a priority. And priority goes from 0 to 9, and the color of this job will be based on that priority. So red for 0 and 9 would be more of a gray color, not as prioritized right now. So, I'm finished with this job now. I can complete the job. Actually, let's check out some of the more options, because there is slightly different options if you're in progress instead of dispatched. So what we can do is to do a round trip in this case if we wanted to, which is essentially I've taken a patient, let's say, to the cath lab in this example, and I know that they need to go directly back to the room that they came from. So here I can select round trip. It'll complete the job I'm currently on and immediately create a new one for that return trip. So just a little bit of a way to kind of simplify that round trip scenario rather than having to complete this job. Then maybe a different transporter would be assigned to the second part of that job, which wouldn't make a lot of sense.
You can show over here in progress.
And see, so over the left side within the capacity instrument, you can see that this job is currently in progress. You can see that there's 2 pending jobs as well. So as soon as I complete this, I will be sent one of those pending jobs that's in the system. So we can go ahead and complete. And directly back into the system, that job was completed successfully, and I've been sent one of those 2 pending jobs kind of immediately that were sitting in the system. And let's go ahead. I'm not going over messages. That's actually the exact same functionalities that was in EVS. Where you can send me an instant notify. and any way she wants to, and she can do that now. We have the exact same settings page that we had for EVS as well. Let's go over kind of the top menu. There's a few additional things here I didn't go over. I can kind of walk through the idea of a mini task. So all I have to do is select that up there. A very simple process of being able to select type of mini task and then mark task as done. And most hospitals are using this feature to complete small little items when there are no transport requests at the moment for the transporters. I can go to the job list if I'm a supervisor and see any of the jobs right now that are pending in the system. And these will be listed by priority. We can see further down the list that there's, a priority 5 for an oxygen tank or else. And so I didn't mention actually that the system also handles item request. So look at this item job right here, and we can see that this item is actually part of a batch job. So we see this is an oxygen tank. It needs picked up at admitting and dropped off at the cath lab. So if I go to this batch job, I can see that this is actually transporting of 2 items, 1 oxygen tank and 1 crash cart, and I can see each item and where to pick them up and drop them off. And there's a lot of configuration that goes into setting up your batch jobs and your item job transports. So you can select them to batch by origin, by destination, by type. There's a lot of different ways that you can set up doing, but this is actually how you would, the new way in which you would see a batch job. The old way, actually, you would see 3 separate jobs, and now we're just showing them on one card with an overview at the top, a little better than before. Let's see.
Do you want to talk about CMS? I'm showing you the item transfer.
Yeah, so in CMS, you can see that there are, pending jobs. Now we're looking at the item transports versus the patient transports that were in the system. There are different tabs within that menu. You can see that there are 2 pending jobs right now, both oxygen tanks. That's okay, and you can see that there was a new job for me button there. That's really a notification letting me know that there's another pending job waiting for me in the system. If I go back to my jobs page, I will see that job from Tom Kirkman. And this is essentially the main functionality of the transport job. There is a few additional things. I think I saw a few questions come across the kind of Q&A about additional things that you're probably used to today, things like rescheduling jobs. I think I saw in there, those are all configurable options that you can turn off or turn on based on the system. So yes, you can still schedule a job once you take that job in progress and reschedule it to a different time. I didn't catch all the questions, but we'll go through a session where we're going to answer all the questions, as many as we can anyway.
Want to show anything else?
I think that's basically it.
Okay.
I'm sure there's going to be lots of questions that I can answer.
26.
6 questions.
So what we're going to do now is we're going to, Kaylee, I'll flip back over the PowerPoint, and then we'll open it up for questions.
Great. Careful, by the way. Thank you.
Thank you. Just give me 1 second.
Yeah, type your questions in or speak now or forever hold your peace. There's quite a few that are coming in, so we're trying to prioritize the ones that we can answer here while we're still on with you, and then I will strategize with the team on how best to answer the remaining ones. So do you want to close with what's next, Reagan, before we move to the Q&A?
Yeah, sure. So what we wanted to do before we got to Q&A is just give you guys a little bit of a high-level understanding or a taste of what we're planning for the mobile team here in the future. What's coming next, right? So this diagram here is really, really high level. It's really showing you what we see as the 3 prime components or 3 pillars that are necessary for mobile to be successful, not only within teletracking, but within healthcare in general. As you can see from the demo and some of the things we've discussed so far, we've really started to hit on some of these things. So real-time data, it's imperative that data that we're presenting to you at a glance on that phone that's either in your pocket or on your cart. If you're an EVS employee, it's imperative that that is current and relevant data for that clinical or operational employee. Also important, right? Tracking is built off of operational efficiency and workflow. So, I believe with what we just showed you, specifically for our EVS and Transport app, you saw that, what we're trying to do is continue to improve those workflows for those two specific role or subsets of employees specifically. And communication, not only through allowing the EVS and transporters to receive instant notifies, the other 4 apps, which we did not demo to you today, we did start to build out and integrate with some of the secure messaging vendors that are out there to allow for you to receive that real-time data, threshold notifications, and then also securely and textually communicate about that data using Mobile Heartbeat. Started with Mobile Heartbeat. That is the vendor we started with, but that is surely not where we will end. This platform is about 2 years old at this point, and this is a high-level understanding of, we started working on these 3 things, but we're going to continue in the future to hit these 3 pillars for sure. With that said, I'm going to flip over to Q&A, and Kaylee, I will open it up to you.
Lots of questions.
Ooh.
This makes me happy because I feel like sometimes there's just no questions at the end of the session. So we have the opposite, 142 people joined, so good job. So we're trying again to prioritize. We're going to start here at the top. Can supervisors for EVS and transport use these apps as well?
Yeah, so they can definitely have a username and password. They can log in. As I said, there is that transport feature that is basically, it's called supervisor workflow, is basically the permission of what it's called in CMS. So you can log in, you can look at those pending jobs in the system, or you can take one of those jobs if you want to. So I think there is some features there, not much different than probably what you're used to today. But we've gotten tons of requests for a supervisor app for transporters and EV supervisors, and we're definitely looking into how we can support that and move towards that in the future.
Great. As people continue to adopt, we definitely will be looking for continued feedback and input on what that view may look like, for sure.
With a large department, how do you distribute iPhones or iPods, and what works best, the iPhone or iPod?
Take it. Yep. So this is a broad question, so I'll try to hit it really high level. And surely, if you guys are interested in adopting, you were to request an upgrade, this is something that our technical teams in our Solution Center could, go into a little bit more details. But I'll hit it at a high level. So we do have a certified device list for what devices are compatible with also the apps, specifically for EVS and transport. iPod's 6th generation will work today with these new apps. There are plans in the next 36 months to discontinue support our EVS and transport apps for iPods for a whole host of reasons. That is the current direction of the organization. As we get closer to that 36 months time frame, if Apple does continue to support the latest versions of iOS, we will definitely revisit that situation. But as per now, our organization is recommending that if you're a net new customer or not currently using iPods, that you choose to use one of the devices that's on our supported device list. I'll go through those really, really quickly with you. Go through the iOS devices first. iPhone 6 and 6 Plus, iPhone 7 and 7 Plus, iPhone 8 and 8 Plus, iPhone SE, iPhone X. On this, iPod 6th generation only, and that's only compatible with our EVS and transport apps. The other do not support iPods, and specifically only 6th generation because any iPod Touch previous to the 6th generation is already on Apple's vintage and obsolete product list, and we will not support devices on Apple's vintage and obsolete product list. Android devices that we are currently QA certified against, and we can guarantee that the rendering and operation of the apps will go well, are Samsung Galaxy S7, Samsung Galaxy S8, Google Pixel 2, and LG G6. Now, we know that specifically for Android, there's lots of different models and lots of different electronics providers. We possibly QA certify against them all. We're not saying that they will not work, but we simply are saying we just can't QA certify against them all and guarantee that the rendering on those will be perfect. So these are the devices that we suggest that our clients purchase to run these applications. Now, as far as deployment goes, I've seen a lot of different models. I've been pretty intimate with a couple of our customers who have deployed on this new platform. Really leave our solution center to go into more detail on some of the things that they have seen. But really, commonly we have seen that it's a tiered approach, right? Or they go in waves, right? So they get their best users first and their supervisors first in their transport department. They'll get their devices, get them set up first, and they basically allow it to be a trainer to train the trainee. That's typically what we've seen. I'm not saying that's the best approach for you. I would suggest that if you are a larger organization, probably a tiered approach is probably best.
Great. A question, but thank you, Marcos. He gave us a clapping hands feedback on this WebEx thing. I didn't know that was even possible. So yes, you guys were great. We have about 20 minutes left, so we're going to try to get through as many of these as possible. Does Charge Nurse app eliminate the need for a separate pager setup? Can there be notifications when new beds are assigned?
Go ahead.
You can tag team it. So I assume, who was the individual asking this?
This is Joseph.
Okay, Joseph. So I assume you're referring to the subscribe CMS notifications that you're sending to a pager or a Cisco phone today or an email of some sort. The answer right now is not yet. That is something that's on our roadmap. We have a lot of clients out there today that send notifications to one of those other devices. And the mobile team is looking into how we can make that integration happen with our new mobile platform. So that's something that is soon to come.
Great. When is the app coming out, or when is it available? Which one? Tom, if you want to respond back and clarify which one, or either of them, if you just want to share when.
Yeah. They're all currently available. So everything. So let me flip back here. That is on this platform slide here. All 6 of these apps are now currently available and in both the Apple and Google Play stores currently, so you can access any of them. However, they are not plug and play. Just merely going to the App Store and downloading these doesn't mean you'll be able to use them. You have to be a current Capacity Management Suite customer on version of 18.4 or above. And there is some additional services or configuration work that needs to be done once your upgrade to 18.4 happens.
Okay. What if the found spill is not in a room? What if it's outside the room, in the hallway, etc.?
Yeah, we've seen people handle this in a number of different ways. Basically, you can define the areas within your hospital as part of those are called. So you could actually define like this hallway as a location, and then I could select it as a spill location. Or you can keep it to the bed, and then you have to communicate with that unit, probably the station or that charge nurse or that area of where the spill is. Typically, in that situation, they'll choose the bed is closest to the spill.
Will change bed size work with auto transport? Also, will the EVS supervisor have to be able to monitor the queue? I think we kind of already answered that one, but the first part again is, will the change bed size work with auto transport?
I have to double check on that one.
Okay.
Have to check back.
Christina, we can get back to you on that one. Will there be more than the initial overview of the clinical applications? There are several participants on the call who are interested in clinical operations specifically.
Yeah, we could definitely shift since we went over kind of EVS and Transporter this time, we could shift the next webinar to focus on the clinical apps, or we could do a separate webinar.
Demo.
Yeah.
Okay. Yep. So Julie, we can connect with you for more information on the clinical one, especially if you have more than one person on the line who's interested.
Or we could do a private demo too. We just have to set it up.
Okay.
With the organization.
So, Julie, if you'd like to connect with me via email when we send out the slides and the recording, I can help coordinate that. Is EVS able to accept a job while in progress on another one?
would have to, so you're currently in progress on a job, essentially, so you would have to delay, you'd essentially have to delay that job before you would to accept a different job and give a delay. That's configurable in the system whether you have to give a delay reason or not. Typically do choose to the EVS employee put a delay reason in, but first you have to delay a job, then take the new one.
Okay. If a team is assigned to a section, can they see all of the beds in that section?
So, employee, and if it's a team, so whatever employees that make up that team, they would be able to see whatever their membership dictates, whatever sections or zones that they are assigned to. They would see the direct bed requests for any of the beds or locations in that zone section.
I think Jane covered this, but just again, can we message somebody from the mobile app? I believe they're asking about the instant notify feature.
Right, yeah. So currently that instant notify is a one-way only from CMS to mobile. As Reagan said, for those 4 clinical apps, we do have an integration right now with Mobile Heartbeat, which is a messaging vendor, where you can do two-way messaging and a lot of other features as well. And we've been looking into eventually how to integrate those messaging services with our EVS and transport apps as well, and that's that's ongoing.
Okay, and I think that kind of dovetails into Marcella's question, will it be possible for the user to respond to the message they receive? So it's the two-way integration.
So I guess just again, I like to hear these kinds of things because the reason that's not in there so far, I'll elaborate a little bit, is because we've heard a little bit of a mixed results on this one, right? So our clients really want their EVS and transport employees to be able to use this feature, and some have said, no way, we are never going to allow for our EVS and transport teams to be able to text, even if it's with a secure messaging vendor. So I think it's just still up in the air. We're still trying to do more research, so we definitely want more feedback on it for sure.
Okay. Is user sign-on required, or is IVR login still an option?
For the new application, username and password will be required. It's a new security standard, so there's much of an option to continue with IVR into the future.
Security officer, we have become ISO certified this past year, and our chief security officer, this actually came down from some of the new regulations because of that, and that is just something to make sure that we are with security requirements and our customers that are adhering with security requirements. We had to make that change, and we can certainly share more information around why we made that change if you're interested in knowing more.
If we are currently using the Mobile XT application, is this new version a free upgrade?
So as far as like upgrade costs go, it was the same as what it is on any standard upgrade. That could be the same. And then as far as, additional costs for licensing or software for mobile, there are no additional licensing or software costs. But please do keep in mind there are certain things that you will need to do in order to use these apps. One of them is purchase devices, which would be a cost. Then an SSL cert, which would need to be publicly signed, which is a cost. There are also some other, architectural things, which again, I'm not going to get into the details on this call. But if you request an upgrade through a link that we will show you later, our Solution Center team will go through those things with you. But as far as software goes, there should be no associated software upgrade or licensing costs.
Just to confirm, the minimum version for CMS required to utilize this new set of apps would be, is it 18.4?
Mm-hmm.
Okay. So I mentioned earlier that the log on with a username and password will now have to happen. Actually, let me see, hold on. I think this is like a 3-parter here. I just want to make sure we have enough time. I'm back to that one because they're just kind of coming down the pike really fast.
10 more minutes.
Yeah, we'll probably try for another 5 to 10 more minutes, and then we'll decide how we can answer the remainder of the questions come in. So back to that one, if the app drops Wi-Fi, does the user have to fully log in once reconnected?
No. So the time you have to sign back in is if you actually close the application, sign out, or your session expires. So if you lose Wi-Fi and then you get back on Wi-Fi, you don't have to sign back into the application. You'll just go right back to the page where you were on previously.
I want to talk about some of the work you did around like the Wi-Fi if it's lost.
Sure. Yeah, so it's just a little bit of an enhancement if you're using Mobile XT today compared to how Wi-Fi worked in the past. A lot of things around that. So essentially, you'll be notified when you lose Wi-Fi just on the bottom of your phone. If you're used to using a lot of mobile applications, it'll say, you know, Wi-Fi not good right now on the bottom of the phone, just right above the footer. And that'll be just a little bit of a notification that you're disconnected from Wi-Fi right now. If you try to take an action during that time, that's when you'll get the error message that you don't have Wi-Fi, you need to reconnect. So there's a little bit of an enhancement there, but a lot of things enhanced in between there, things like you won't reject a job if you lose Wi-Fi or anything like that anymore. So I think there's a lot of little enhancements that go along with some of the Wi-Fi improvements.
Does the EVS view show prior isolation precautions, and will EVS know if of isolation, when going into the room?
It does show isolation, but as far as previous, I'm not really sure what they're defining previous as, but I don't believe it would show like previous isolations, but it would show whatever is current for that patient.
Yeah, right now it only shows one isolation type.
Okay. Can 3 or more travel requirements be placed in the request?
As many as you want.
Okay.
Yeah.
Can a transport user reject jobs from the app?
Okay, so there used to be a feature right there on the front of the My Job. When you first receive a job, you have the option to basically reject that job. And that was really a remnant of the IVR days where it's presenting you that information in a different fashion. No need for you to have that reject job anymore. If you take the job, basically the process is to delay that job or give a reason code, or take that job in progress and delay it for whatever, or suspend it for whatever reason is relevant to that, and take the next one. So basically, it's simply rejecting a job, but giving a reason for why you're delaying or suspending that job. There are some differences in how jobs are now held to users, and the hold timer, which is basically you reject a job if you move the app or go to different places. You have to take a specific action that's relevant for that job to go from an available status to suspended or delayed.
The logic for the rejection is quite robust, and there's probably a lot of questions about it because a lot of reporting is done around this. So if there are any clients who are interested going through that in detail, we can certainly do that because there's a lot of logic there.
Can transporters still schedule or reschedule jobs while they're in that delay state?
Yeah.
Okay. Is there a pushing system where the job is assigned to a transporter?
Yeah, understanding of that question. It's the dispatch engine. So there's a lot of little configurations you can do to the dispatch engine, but essentially that is taking a transport request and auto-assigning it to transporters that were within the section or zone.
Based on the logic.
Based on the logic of that dispatch engine.
Can you explain how the battery life is improved by this app?
Sure. So I don't have numbers for you, but the basic premise is that we're going from an app that is a web app, so you have to have you're basically using that app within Safari, and basically you're draining the battery more by just using it in Safari versus it being a native application, and also move from an auto refresh of every 30 seconds to just the page refreshes when you move from page to page or take an action, or hold refresh, and that changes a lot of things. So instead of having to do a back-end call every 30 seconds, we only do that back-end call when it's necessary, and that itself is saving battery life.
If we do not upgrade to the new version, can we still use the older version? We are on OS version 11.3.
So that's a really, really good question. I'm glad it was asked because I wanted to hit on this. So we the path to redesign these two apps as a replacement for Mobile XT. So what we will be doing is that we will be following our support and maintenance policy. And in line with that support and maintenance policy, 36 months now, from February 6th when we actually launched these two apps, current Mobile XT application will fall in line with that support and maintenance policy and will be no longer supported. So the specifics of that are listed out in that support and maintenance policy. So we are urging clients to upgrade to the latest version of Capacity Management Suite and adopt these two new mobile applications that are intended to be a replacement for Mobile XT.
A couple questions on how people can connect with somebody to get the private demo. So I think that our answer across the board is you can either respond to my email, send, and then I can connect you with the right person, or if you know who your client success manager is and you're a current client, we like for you to connect with them and they can work with Reagan and Jamie to schedule something private or more tailored to your specific needs. So I think we're going to go ahead and close down. We have more questions coming, so I want to make sure again that we are respectful of your time because an hour is a long time to be on this session. So just in closing, I think there's quite a lot of interest about these new mobile apps, so we have a couple of ways for you to find out more information. We have a really great, robust resource center on the TeleTracking.com website. So I'll send a direct link in the email for you to download the new mobile apps data sheet through our resource center. So stay tuned for that. Also, please feel free to reach out to marketing@teletracking.com for additional information or simply reply back to my email. And then last but not least, we are asking if you're interested and you're ready to go that you can schedule your upgrade today to get these new mobile apps for CMS. I'll also send the upgrade request link in the follow-up email too so that you can complete the form and get listed in our queue. So the next webinar that we have available is coming up in a few short months. It's scheduled right now for May 22nd at 12 p.m. Eastern Standard Time. Again, I'll be switching over the registration for that session shortly after this webinar concludes, so it's the same link, go.teletracking.com/mobile-apps that you can use to register for the upcoming session. 22nd. So in conclusion, I would just like to thank everybody for being here. Again, I know an hour of your time is a lot to take away, but we really appreciate you being here. We appreciate the interaction, and certainly we appreciate the two subject matter experts, Reagan and Jamie, who were here with us today. So thank you again, everybody. I love seeing all the familiar names on the line, so hello to all of our clients out there. And again, thank you for being here. And Reagan, Jamie, thank you.
Thank you.
To everyone.